Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikiolu. First, the highlights. Impressive turnout at the Edo Vaccination Center for the second phase of the exercise. Officials say they have now exhausted their Moderna vaccine supply. Well, experts at an annual physicians meeting say the pandemic shows there is still much to be desired in the health sector as they ask governments to act on lessons learned. And the UK is set to increase vaccinations to meet up with 12 to 15-year-old demands. Well, it's a holiday here in Nigeria to mark Eid al-Maulud, the birth of Prophet Muhammad in the Islamic calendar. So happy holiday, or at least what's left of the day, and to all essential workers, including frontline health workers who may not have the luxury of a holiday, no thanks to COVID-19 and other health exigencies. Thank you for the sacrifice. Well, COVID-19 clearly is not on a holiday just yet. The latest figure of confirmed cases has increased, and it increased Nigeria's infection toll to 209,387, with 89 positive cases in the last 24 hours. Meanwhile, for the epicenter of the disease in the country, that's Lagos, there were no updates on the pandemic situation. Well, there's a breakdown of the latest COVID infection rates in other parts of the country.
89 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states, indicating a drop from the figures reported earlier. Kaduna logged the highest infections with 34 cases, followed by Abia, which had 22, while Delta registered 11 cases. Kano and Rivers recorded 8 cases each. Bauchi had 4, while Jigawa and Zamfara states registered 1 case each. There were no cases reported from Edo, Gombe, and Sokoto states. The new tally has increased the total confirmed cases in Nigeria to 209,387. 169 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 197,312. Lagos is leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Oyo, and Akwa Ibom states. 1 person was reported to have died from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,838. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. More than 5.3 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 2.6 million persons have been fully vaccinated so far. In Africa, there are more than 8.4 million confirmed cases, and over 214,000 deaths have been recorded across the countries on the continent. The total global confirmed cases have surpassed 241 million, while deaths are beyond 4.9 million.
Well, health officials in the Iwase COVID-19 vaccination center, which is one of the inoculation points in Benin City, the Edo state capital, say the turnout of residents has been encouraging as it has vaccinated over 1,000 persons since the commencement of the second phase of the exercise in the state. And now they are out of doses of the Moderna vaccine, but they still have the AstraZeneca vaccine available for those interested.
At first, when we started, we thought that the turn-up will not be encouraging. For today, as of today, making it 20th of October, we had this center under St. Philomena. Today is 19th under St. Philomena ward. We have been able to record what we made AstraZeneca, total beneficiary capture into our database, 959, while the Moderna, 492. So far. So the turn-up by this administration has been very encouraging. Today, on the 19th of October, we have vaccinated 30 persons, AstraZeneca, 10 per doses, and we are shortage of Moderna in our center right now. I believe the state will also do something to make sure that those that are due in Moderna in the second phase, second dose, will also come and receive their own.
Medical experts and human rights activists say if Nigeria must achieve prosperity and security, then its healthcare system must be strengthened to ensure accessible and affordable healthcare services, as well as increase health-seeking behavior among the Nigerian population. Others said this during an event to mark the Nigeria Medical Association's Zamfara State Physician Week in Gusau, the state capital.
It's the Zamfara State chapter of the Nigerian Medical Association Physicians Week. Discussions focus on Nigeria and the COVID-19 era and health systems threatening for national prosperity and security.
Let me start by...
Discussants at the event believe that COVID-19 pandemic has exposed the healthcare system in Africa as weak, especially in the areas of funding and workforce.
Healthcare is no longer confined within the walls of the hospital. You see, during COVID pandemic, at the airport, mosques, religious centers, everywhere, you see people are taking measures to prevent themselves, to prevent transmission of COVID.
According to them, funds are important, but there are other things which can make or break the health system.
COVID-19 has provided opportunities, actually, for us to really diagnose our health system. On the background, we also know that generally we have a very weak health system. And now coupled with the COVID-19, you understand, so it actually further stretch the health system the more. And as you are aware, also even policymakers have actually agreed that, yes, this is the right time for us to be able to strengthen the health system.
The permanent secretary of Zamfara State Ministry of Health, Habibu Yelwa, says health has become a social, economic, and security issue, and that's because of COVID-19 pandemic, which has made Zamfara State wake up to its responsibilities.
Coincidentally, this COVID-19 scourge has exposed the healthcare system world over of what is it that is being needed with regards to development, advancement, other things for the health sector. And sincerely, we've taken advantage and opportunities of that. And here in Zamfara State, I assure you the state government has done enough.
Guests at the occasion all believe that COVID-19 has been an eye-opener and attention must be paid to the gaping holes the pandemic has exposed with a view to repair.
Joining us on the program to discuss ways to strengthen the health sector, especially in the area of funding, is Dr. Laz Eze, who is the Secretary National Advocates for Health. He joins us live from our Abuja studio. Thank you for joining us on the program, Dr. Eze. Well, I know that as far back as 2017, the then Minister of Health, Professor Isaac Adewale, selected you as one of the 26 National Advocates for Health to essentially lead advocacy to improve quality and accessible health care in Nigeria, especially through funding. 4 years on, what can you tell us, really? What have you found out to be the biggest challenge to funding healthcare appropriately in Nigeria?
Well, thank you very much, Kayode. The biggest challenge is the political will, I must say, because for we to have 15% minimum that the African heads of governments in 2001 here in Abuja declared that all countries in Africa must dedicate at least 15% of the annual total budget to health. We've not gotten anything close to that, and it requires political will to make it happen, and not just at the federal level. In Nigeria operating a federal system, the federal government should appropriate 15%, and every state should appropriate at least 15%. But not just the overall budget. You now begin to look, where does those money go to? Reproductive, maternal, newborn, child, adolescent, elderly health, plus nutrition and mental health as well. These are areas that, most of our poor health indices are as a result of poor reproductive, maternal, newborn, and child health. And that's why it's kind of prioritized. Primary health care should be strengthened. The 6 building blocks of the primary health care should be strengthened. While we keep pushing at the National Advocates for Health for there to be more money for health, we are also asking for us to get value for money. In this year, the budget is about 4.3% of the total budget that went to Federal Ministry of Health. If you include the ones of Ministry of Defense, like the barracks and all that, they have hospitals and all that, and perhaps other ministries, maybe it might take it to around 5.something%. That's still grossly inadequate. So we must demonstrate more political will at every level of governance to make our hospital work.
You know, let's take a look at the breakdown of the 2022 federal budget, to be clear now, because, I mean, there's an angle for states as well. But, you know, the government will tell you that looking at that budget, the health sector got 820 billion naira, and that's exactly 5% of the total 16.39 trillion. And, of course, the government included the 54.87 billion naira for Gavi immunization funds, as well as 54.05 billion naira for transfer to the basic healthcare provision fund. But like you said, the target is 15%, or at least the goal is 15%. And from what you have said so far, the gap between the 5% and the 15% is political will. Now, that's a term I've heard a lot. It's been thrown around a lot. But let's come down to the basics. What does that mean in terms of appropriation in the reality of things?
Well, in terms of appropriation and reality is, what we simply mean by political will, is that the leadership is really interested, you know, to invest sustainably in health. And why is this important? You know, mostly the political class look at health as charity. They look at it as just humanitarian things. But health is everything, and COVID-19 has clearly demonstrated that health is a business, health is a security issue, health is an economic issue. Let's look at the business of health. Let's invest to create an enabling environment for our pharmaceutical companies in Nigeria, more than 100 of them, to be able to produce most of our commodities within the country. As part of this COVID-19 stimulus, about several billions of naira was allocated to support local manufacturing of medicines and vaccines, but not many of that have been released. So right now, it's more profitable to import drugs into Nigeria than to manufacture inside the country. And these are some of the issues that we must have available: commodities, consumables, and things that we need, you know, to provide quality services, and not importing most of them. The human capacity development, we must be able to train. We are training a lot of health personnel, even though the number we're training is not enough for us, but we are losing most of them. We must be able to provide enabling environments and the motivation for the health workforce that we are training to remain in Nigeria, work in Nigeria, and work for Nigerians. What we have now is the reverse. Many people are leaving the country because either they are earning well and the environment is not so conducive. So there's a whole gamut of areas we need to invest in: sustainable medical products, vaccines, and technologies that are appropriate and, you know, usable within the country. The human resource for health. The health financing has to be sustainable. Health insurance has to cover everybody, you know, so it has to be mandatory. Car insurance is mandatory. So why shouldn't every human being in Nigeria have health insurance? So right now, out-of-pocket expenditure is over 70%. So we must reduce that, and government must invest more sustainably to make our health sector work very favorably for our people.
You know, quite interesting analogy you paint there with the vehicle insurance and human insurance, or health insurance at least. And, you know, the questions about affordability. I mean, if you can afford a vehicle, I mean, you should be able to pay at least 5,000 naira for third-party insurance. But then the questions about affordability. But you have raised a lot of issues. And as we wind down, if you were to tell the government, now at various levels, that is federal and state, the best next step to take in the health sector to show that political will, to show that they're willing to ensure that the health sector is better, what will that next step be?
Yes, that next step will most importantly be at the state level, because that's where we have most gaps. In Nigeria, the way the health system is designed, the community is involved. Every community should have a health committee. Any community or village without a health committee is like a state without a Ministry of Health. So community must be involved. Our primary health care can take care of over 80% of our health burden or disease burden if it's made to work effectively. And that's where the work is. If the primary health care is not working, our tertiary hospitals cannot work. Right now, because the primary health care is not working, cough and catarrh, uncomplicated malaria, everything goes to the teaching hospital. And that kind of puts a lot of pressure on it, and is unable to even provide quality health care for complicated cases that is meant to go there. So our state government, through the state primary healthcare development agencies and the state health insurance agencies, must be, invest more resources and create enabling environment for the private sector to invest as well sustainably in the health sector.
Well, very, very important points you have raised. I would like to thank you so much, Dr. Laz Eze, Secretary National Advocates for Health, for sharing those thoughts with us on the program.
Thank you, Kayode, for having me.
COVID-19 cases in the UK are on the rise once more, with 49,156 reported on Monday, and that's the highest figure since July. And this increase appears to be driven by growing case numbers in England. Coincidentally, it was on this day, 3 months ago, on July the 19th, that the British Prime Minister Boris Johnson announced the lifting of COVID-19 restrictions in spite of criticisms from government scientific advisors who warned that this might lead to the emergence of more variants and spike in cases. Well, on that day, the UK recorded 39,500 cases, and exactly 3 months after, the UK has topped that with an extra 10,000 cases at 49,000. Well, our London correspondent Juliana Olainka joins us now to give us an update from the UK. Hi, Juliana. Well, why does the UK have one of the highest COVID infection rates in the world right now?
Good evening, Kayode. Gosh, to answer that question, I'd probably have to go back 19 months, of course, to the start of lockdown, which seems like many years ago. But of course, you know, it was slow to close the borders, slow to lock down, slow for people to follow the rules. But if you bring it back to today and just, you know, coming off the back of those statistics that you've just read out, you know, there are huge issues. COVID-19 is spiraling in the UK once again, as you said, when Boris Johnson, the Prime Minister, back in the summer, made a pretty strong statement and decided to completely open up society. I've got to say, much to the enthusiasm from the public, because everyone was sick to the death of lockdowns and restrictions. And of course, the Chancellor Rishi Sunak was in his ear about opening up the economy. The experts did warn that, yes, we are opening up, and yes, we do have a successful vaccination regime, but COVID is going nowhere. And that's what we've seen in the case numbers today. Not only are there over 43,000 positive COVID cases, there are also 233 deaths. And it's that death figure that I think has sent shockwaves amongst the health and scientific community. This is the highest number of deaths that we've seen since March of this year. There are lots of different reasons as to why this potentially is the case. But I think most people would say, of course, this is down to human behavior. Most people are at work now. I was on the tube early this morning, Kayode, to get into the studio, and it was absolutely jam-packed. Are most people wearing masks on the tube? Yes, but in some places, going to department stores or any of our viewers that have been in London over the past couple of weeks, you can see that, you know, people are kind of pandemic fatigued, COVID fatigued. They kind of feel like we've gotten over the worst of it. And they're moving on with their lives. There is so much going on in the country, as you would know, whether it's the supply chain issues, COP26, which has been at the top of government agenda over the past couple of weeks, that, you know, not many people have really been paying attention to the pandemic. But after these figures were released early this afternoon, we did have a statement from the government spokesperson. The government, well, the Prime Minister and senior government ministers are in Windsor Castle at the moment with Her Majesty the Queen and 200 business executives. But we are told that the government are taking these figures very, very seriously. And so they should, because of course, you know, once again, these are over 200 people that have lost their lives.
I mean, so much for the government and the people to really grapple with at this time, as you have spoken about. But I mean, that classic debate about life and livelihood is yet again a major issue. Talks about a certain plan for lockdown or not, but we'll come to that in a moment. But let me see if I could take you to the scientific part of things. Is there anything you can tell us really about the new mutation of Delta variant, which is under close watch in the UK?
Well, absolutely. The Delta variant, formerly known as, the variant that came from India, has wreaked havoc, not just in the UK, but of course across the world, which is why so many regions, particularly in the Asia Pacific, are still very slow to open up. I believe Australia just opened up after being locked down for almost about 180 days. But there is actually a new mutation from the Delta variant. I don't know if this is breaking news or something, but it's actually called AY.42. I'm sure the experts will be giving it a much more easier name, but this has been spotted in all regions across the United Kingdom. It's apparently much more deadlier than the Delta variant. And I think one of the issues that a lot of Brits or British citizens are having is, how does this vaccine work? Even though Britain had one of the highest death tolls in the world for COVID-19, that headline was quickly shelved because we had one of the world's most successful vaccination program. And clearly we did, because the case numbers and the death numbers went right down to the bare minimum. But how effective is that vaccine? Because now we're told that we need to have a booster jab. The booster jab is very, very, very slow to roll out. I believe about 3 million people who are eligible have had a third shot in their arm. I believe 5 million eligible adults who are vulnerable are yet to have this vaccine. So I think, there's lots of confusion about the messaging, Coyote.
Honestly, I can imagine how that feels, really, Juliana. But on a final note, so let's wind down with this one. Just how close is the UK to reimposition of restrictions right now?
Oh, goodness me, please don't mention that terrible word, restrictions and lockdown. It certainly sends a shiver up my spine. But, it's a good question. And I certainly think amongst the headlines tomorrow, people, will be asking that, because it is getting worrisome. There's a half term coming up. 12 to 15-year-olds are being offered the booster jab. I believe about 15, not a booster jab, the initial jab, about 15% of that age group have had one so far. But another lockdown, goodness me. We have a populist prime minister here in the UK. He likes to do what the people want, and the people do not want another lockdown. But of course, people do not want their loved ones dying as well. It's such a delicate balance, but COVID has gone nowhere in the United Kingdom.
One of those people definitely is Juliana Olayinka. It's been a pleasure speaking with you on the program this evening, Juliana. Thank you so much, and do stay safe.
Thanks, Kayode.
Well, we have more from the UK and other parts of the world in our global update.
It's clear that the vaccination program in 12 to 15-year-olds is not going very well.
Mr. Javid's announcement in Parliament today comes as the Teachers' Union complained earlier about schools reporting problems such as the vaccination teams having insufficient staff to deal with the number of students needing jabs, running out of vaccines, cancelling or postponing sessions, or even not turning up when they are arranged to. Meanwhile, the government says a new mutation of the COVID Delta variant had been spotted in the UK, and tests are ongoing to find out more about it, though experts say it is unlikely to take off in a big way or escape current vaccines. Northern Ireland says wearing face coverings in crowded indoor spaces will remain a legal requirement throughout autumn and winter. It is part of the executive's winter COVID contingency plans outlined today. First Minister Paul Givan says there will also be a focus on flexible and hybrid working in workplaces, and set out a range of COVID-19 cases rising sharply or hospitals' pressures becoming unsustainable. Meanwhile, children as young as 6 have started receiving COVID-19 vaccines in Ecuador. The South American country is giving the vaccine to 2 million children aged 6 to 11. The country's Vice President, Alfredo Barrero, kicked off the rollout at a school in the capital, Quito. Finally, China is concerned about spate of COVID-19 cases confirmed in multiple provinces and provincial level regions. Mainstream media are reporting that at least 9 cases have been confirmed in Shanghai province, 7 in Mongolia and 6 in Gansu, all in China's north. Individual cases have also been detected in Beijing, Guizhou, Ningxia and Hunan province. The Beijing case was a close contact of an earlier patient. The remaining 3 cases all had a history of travel in Gansu. Although cases remain in the single digits in each provincial level region, there are fears that China could be on the cusp of a more widespread winter outbreak.
And just before we go, don't forget you can catch all the latest COVID-19 updates, as well as other stories on sports, politics, business, and so much more on our website, channelstv.com, your home for the news. Well, that's the program for today. Thank you for watching. I'm Kayode Okikiolu. Do stay safe.